Scoliosis, a very common problem for women. Scoliosis is a condition in which your spinal column has an abnormal curvature. It's likely that simply saying or reading this word makes you immediately think of children. This is a congenital problem that many young people in the world live with. And, for most cases, after using the classic orthopedic apparatus, it can be corrected. Now, a good number of people in our society have some kind of scoliosis as a result of a slow osteoporosis process. Women who have already reached menopause are the ones who experience torsions and rotations in the curve of their spine. This happens to the point where X-rays show these very characteristic curves in the shape of a C or an S. It can be said that this deformation is also painful and affects your postural axis. In some cases, it can be severe. It can lead to a striking deformity where the person sees their spine sink inside or where their pelvis slips off to one side. This is a fear that isn't talked about frequently. Today, we'll take a look at its symptoms and treatment. Scoliosis affects females at a high rate. Congenital scoliosis also affects a slightly larger number of girls than boys. At the same time, reaching the adult age, women are also the ones who experience greater bone and joint problems. So, scoliosis is a condition that can appear distinctly when menopause arrives. Thanks to a study carried out by the Johns Hopkins Hospital and published in the magazine American Journal of Neuroradiology, they have confirmed this data once again. However, they also solidified some more interesting pieces of information. One of them is the fact that a large part of scoliosis cases is light. And, only 17 were moderate or severe. Why does scoliosis appear? Scoliosis in adults gets the name degenerative scoliosis. With just this name, it gives some clues to the origin and the cause that determines this abnormal curve in your spinal column. In general, scoliosis in adults appears markedly after 65 years of age. However, in women, it can start to show symptoms after 40 or 50 years of age. This is when the effects of menopause affect the quality, strength, and resistance of your bones and joints. At the same time, you should remember that osteoarthritis or arthrosis is localized in a special way in the smallest joints of your spine. What are the symptoms that degenerative scoliosis presents? At the beginning, this light deformity doesn't give too many clues. There are those who usually think that it's a simple problem with ligaments. However, little by little, we can feel numbness, stabbing in your lower middle back, hands or legs falling asleep and it's common to feel a great exhaustion. Sometimes, it's difficult to breathe. The pain is more intense in the mornings and when you're sitting. In other words, resting makes the symptoms worse. The symptoms, like we usually look for, are more evident when the person sees the deformity for themselves. Their spine is out of place, one shoulder raises higher than the other, a light hunchback, noticing they've lost a few inches of height, and differences between degenerative scoliosis and juvenile scoliosis. Scoliosis in adolescents can appear between 10 and 18 years old. And this happens without really knowing why. As we've said at the beginning, scoliosis is, in the majority of cases, congenital. But, in degenerative scoliosis, we do know the cause. What is still more important, the misalignment of the spine tends to grow by at least 1 or 2 grades each year. Treatment for scoliosis in adults. Surgical treatment isn't always possible or recommended. From there, the patient needs to focus on the problem from a multidimensional point of view. They do this with the help of the right professionals. To do this, you need to make use of the following focuses. Pharmacological, there are many medications that relieve the pain. These include the classic ibuprofen or acetaminophen. Above all, these reduce the level of inflammation in your joints. Epidural injections are another option. Physical therapies for scoliosis in adults. In this case, we have help from good physical therapy to aquatic therapies, or chiropractic alternative medicine, or a complement that helps you treat multiple neuromusculoskeletal problems. The best thing is to not just stay with one treatment. To increase your quality of life if you suffer from scoliosis, you need to take advantage of everything that good medical professionals tell you. This way, you can use more new therapies and strategies that help you to have a better quality of life as much as is possible.